When you or someone you love gets an ALS diagnosis, the path forward can just feel, well, it can feel like a lot. So we've put this explainer together to be your roadmap, breaking down the critical federal support that's available right when you need it most.
Look, it's a really overwhelming time. It's filled with so many questions about health, finances, and what the future looks like. And it's completely understandable to feel that way.
But here's the thing I really want you to hear. You are not alone in this. There's a whole federal support system in place, and the most important thing to know is that for the ALS community, a lot of these benefits are specifically put on the fast track to help you right away.
Okay, Section 1, the challenge of ALS. First, let's just acknowledge the reality of the situation, especially the financial side, and then see how these federal programs are actually designed to tackle that head-on.
So let's jump right into Section 2, Fast-Tracked Financial Support. This is all about getting income replaced quickly to keep your family financially stable. First up is Social Security Disability Insurance, or what everyone calls SSDI. Now, the key thing to get your head around is that this is not a handout, not at all. It's an insurance program that you've earned and paid into with every single paycheck your whole working life. And this is where things really kick into high gear for ALS. Your diagnosis gets special treatment under what's called the Compassionate Allowances program. This basically flags your claim, puts it right on the top of the pile, and slashes the approval process from months and months down to just weeks or sometimes even days. It's a huge deal. Now, just to put that in perspective, for almost every other disability, even after you get approved for SSDI, there's a mandatory 5-month waiting period before you see a single dollar. You can imagine how stressful and difficult that waiting period is for families. But here it is. This is probably the single most important change in the law for the ALS community. That 5-month wait, it's gone. Poof, waived completely. This means your payments can start immediately after you're approved, getting crucial financial relief into your hands right away.
So it's really easy to get these two confused, but we need to talk about the difference between SSDI and another program called SSI. Remember, SSDI is based on your work history, what you paid in. SSI, or Supplemental Security Income, is different. It's based on financial need for folks with very low income and almost no assets, and it doesn't matter if you have a work history or not.
Now, the big takeaway here is that these two programs can actually work together. Your SSDI payment depends on how much you earned, but if that amount is low, SSI can actually kick in to supplement it. Plus, your family might be able to get benefits too. Okay, so that's the financial piece. Now for Section 3, immediate healthcare coverage. Because that same fast-tracking idea, it applies here too. And again, the rules are different and way better for people with ALS. This might be the single biggest healthcare advantage there is, period. Normally, people on disability have to wait 2 years, a full 24 months, for Medicare to start. But if you have ALS, that waiting period is just gone. It's totally eliminated. Your Medicare coverage begins the very same month your SSDI benefits start. So what does Medicare cover? Well, Part A is for hospital stays. Part B covers your doctor visits, but also, and this is so important, it covers what's called durable medical equipment, or DME. We're talking about the big stuff, power wheelchairs, hospital beds, and those vital communication devices. And then Part D is for your prescriptions. Now, what if those Medicare premiums and other costs are still too much? Well, there's another safety net, and it's called Medicaid. It can step in to help pay for your Medicare costs, and it also covers other things Medicare doesn't, like long-term care at home. All right, let's pivot for a second. Section 4, specialized aid for veterans. Because if you're a veteran with ALS, there's a whole other level of support, a really robust system just for you through the VA. The whole system for veterans is built on this one powerful idea, presumptive service connection. So what does that actually mean? It means if you're a vet who served for at least 90 days, the VA automatically assumes your ALS is connected to your time in the military. You don't have to prove a thing. And that one simple rule is the key that unlocks everything else we're about to talk about. So what does that presumptive connection actually get you? It gets you a 100% disability rating, automatically. And that 100% rating, it is a game changer. We're talking a substantial, tax-free payment every single month. We're talking specialized healthcare at VA centers with zero copays, massive grants to make your home accessible, and, this is so important, real support for your family caregivers, including a monthly stipend to help them out. Okay, so we've covered income and healthcare, but there's more.
Section 5, More Lifelines and Hope. These are other federal programs you really need to know about, plus some really important stuff about research and what's on the horizon. So, a few other lifelines to be aware of. There's housing help through HUD, better nutrition benefits, and these really powerful tools called ABLE accounts. They let you save money for disability expenses tax-free, and it won't mess with your other benefits.
And this is about looking forward. The ACT for ALS is a huge deal. It's funneling $100 million a year, every single year, into research. And get this, it's helping people get access to promising new treatments even before they're fully approved. It's about attacking this disease from every possible angle. Whew, okay, we have covered a ton of ground. So for our last section, Section 6, Navigating Your Benefits, let's pull it all together. Let's talk about how you take all this information and turn it into a simple, clear action plan. So where do you start? It's actually pretty simple. Here are your first steps. Step 1, just get your medical paperwork together, the documents that confirm your diagnosis. Step 2, and this is the big one, go to ssa.gov and apply for SSDI right away. Don't wait. Because of that fast-track process, this is the action that triggers everything else. And third, you don't have to do this alone. Reach out to expert support teams, like the ALS Association. They can walk you through all of this. Look, I know the system can seem complicated, but it is set up to help you. All those special rules for ALS are there to cut through the red tape and deliver support fast. So I'll just leave you with this one question. What is the one step, the very first thing you can do today to start unlocking all this support for you and for your family?